Hello everyone, this is the Academic Channel and I'm Maya Pלד-רז. With me today is Dr. Peter Dאנקן from the Center for Public Policy Research at King's College London. And I thank you for coming to חיפה University and for joining us for this talk. Well, the reason for our talk is basically the new book you just published, which is called Critical Perspective on Health, published by Palgrave Macmillan. But before we get to the book itself, I would like to ask you, you're a philosopher. You came from philosophy teaching, and I wanted to ask you how that reflected on your dealing with health, how you got to the health issues from starting from philosophy.
Yeah, well, I started off by doing a degree in philosophy, and which I enjoyed, but at the end of it I thought, well, what is the point of philosophy? Why do it? It seemed a very sort of obtuse and quite an ivory tower sort of subject. So I then went off and almost in reaction to that kind of ivory towerness, I went to train as a nurse, because I thought it would just be completely the opposite, the antithesis, and would kind of give a bit of balance back into my life. So I did that, and then for one reason or other I kind of left nursing, did a variety of kind of jobs with a sort of, I suppose, a kind of sort of health education, health promotion sort of flavour. Eventually ending up back in our National Health Service in England as a specialist health promoter. And at that point, or just before that point, I started to do a master's degree in health education. And as I began to do it, it suddenly occurred to me that it was kind of sort of almost my version of a sort of a vision, a blinding light. It suddenly occurred to me that a lot of the issues that were emerging in health education, in terms of things like to what extent is it reasonable to promote health, what kind of health are we promoting, how far should we persuade individuals to change their behaviour, and so on and so forth. All of these questions were in fact kind of ethical questions that related back to the academic study I'd been doing 10 years before. And so I started to develop an interest in the application of ethics to health promotion, and it was quite a good time to be doing it, I suppose, because there was sort of an emerging interest in this sort of period, the late 1980s, early 1990s, in the application of what was called bioethics, medical ethics, healthcare ethics, to non-mainstream medical fields like health promotion and health education. And I was very much assisted by a number of people who kind of sort of supported my work and gave me encouragement and so forth, so that after having finished the master's degree, I then wrote my doctoral thesis on the moral problems associated with health promotion, both at the level of theory and practice, and that kind of came up with quite a sort of interesting argument, I say it myself, but an interesting argument about the nature of health promotion and how it was impossible to sort of disentangle what health promotion was trying to do, its purposes in terms of improving health, changing behaviour, changing structures to make them more healthy and so forth, and kind of ethics and the limits to kind of human action and inaction in terms of ethics and morality, and so I wrote that, and almost at the same time got a job at King's, and ever since then, really, one way or the other, have been working. My primary research interest really is kind of the philosophy of health, and stemming on from that, the kind of the nature of health education and health promotion theory and practice, and how we need to see that through a kind of sort of ethical lens. So that's really where I am now. It's a fortuitous connection of previous experiences kind of all coming together, really. Yeah.
Going from there, did you think that there's a need for specific separate thinking about health promotion ethics, to distinguish that from the general bioethics thinking and writing? Yeah,
I think health promotion in many ways is a kind of different enterprise to medicine. I mean, for a start, its aim is to improve health as opposed to treat disease or cure illness or whatever. So it's a different kind of enterprise. It, generally speaking, very often involves people who are not necessarily ill in the first place, but who are quite healthy, and somehow health promoters believe that they need to come along and make these people more healthy than they already are. So, in those kinds of ways, health promotion is a different sort of enterprise, and therefore, the whole area of kind of sort of public health and health promotion ethics demands to be thought of separately. I guess the difficulty is that, generally speaking, what has happened in the kind of history of health promotion and public health ethics is that people involved in those areas have basically used the same kind of tools, taken advantage of the same sorts of methods as people working in bioethics, medical ethics, the kind of ethics of patient-doctor, if you like. Those are the tools that health promotion ethicists that have used, and I suppose one of my interests is to kind of work out the applicability of that approach in this very different field of health promotion. And given that I think the two actually don't go together that well, how can we examine health promotion as an activity that requires ethical examination in different ways? I'm not saying that we should kind of abandon the bioethical tradition completely. What I am saying is that it's very helpful in some respects and to a certain extent, but we need other kinds of stuff as well to help us think about whether what's going on in health promotion work, ethically speaking.
Right, and for that, you say in your book, among other things, you need to decide what health is.
Yes,
right?
Yes.
And that leads us to your book. Could you tell us about a little bit about the main thesis?
Right. Okay. Yeah. I mean, the book, Critical Perspectives on Health, kind of begins with the sort of premise that those people kind of coming to the study of health, and they're many and varied. I mean, we think of kind of nurses and doctors, but kind of professions allied to medicine, and so on and so forth. All of these people, even people who are kind of involved in social care, come to, in some way, kind of study the nature of health and engage in thought about kind of what it means to be a healthcare practitioner and to consider issues around healthcare. And my premise is that coming to this study is difficult, and it's difficult for a number of reasons. The first one is, in the first place, health is a contested concept. It's something that we dispute and contest, and we can dispute and contest quite dramatically and vigorously. On the one hand, we have people who perhaps believe that what health is simply the absence of illness. All that we need to do to make ourselves and our populations more healthy is to reduce illness through traditional kind of treatment and care sorts of services. So there's the absence of disease group of people, if you like, and then on the other hand, there are people who believe that health is actually much more than that. That it's it might perhaps involve absence of disease, but we're also talking about things like kind of well-being, spiritual health, positive mental health, and so on and so forth. And each of those kind of traditions comes with certain views about how we can kind of sort of understand, how we can kind of quantify, how we can establish what the nature of health is. We could suggest that people who believe that health is the absence of disease broadly come with quite hard, objectivist, quantitative understandings, of what health is.
Clear
it's measurable.
Evidence, yes.
Absolutely, yeah, evidence-based and so on and so forth, randomised control trials and things. So there's that kind of sort of camp. And on the other hand, there's the health as something else camp, whose views are much more subjective and interpretive, and attempting to kind of sort of understand sort of, through qualitative methods, the sort of deep meanings that are attached to health. So there's this conflict, and one of my suggestions in this book is that people engaged in healthcare often come to health studies as part of professional training, or if they're studying in a postgraduate way, they come after having done their professional training. And it's my argument in this book that in coming to the study of health in that kind of way, through or as a result of professional training, our ideas on what health is have already been formed, and they've been formed as a result of the development of our professional identity. I mean, for example, I trained as a nurse, and I spent quite a long, sort of 2 or 3 years in my nurse training dealing with people who were lying sick, sometimes mortally sick on hospital wards, fighting all kinds of diseases. And the role of the nurse and the role of the doctor, the role of the healthcare team was to treat that illness. And so you saw success as illness being treated
abolished, yeah.
So absolutely such that people kind of managed to leave hospital unaided. That was how I saw healthcare being conducted, and therefore that's what I started to see health as. I started to see health as that process of treatment that led to disease being diminished, illness being dealt with successfully. And my argument is that that's not an uncommon experience, that people who kind of go through those dramatic years of professional training, where really their lives become synonymous with their work and their study, it is all embracing. It's very difficult, having gone through that, to come to the kind of position where you think, well, maybe health isn't that after all. Maybe health isn't that sort of treatment of disease. Maybe there are other ways of seeing health that are more holistic. My suggestion in this book is that my argument in this book is that that's quite a difficult position to come to actually reach.
You might say that also that kind of burdens the whole health promotion profession, because when you have people coming into the profession from so many different original professions, it's kind of hard to get them to work together if they bring so different perspectives of what they're trying to reach.
No, absolutely. I mean, I think this is one of the challenges for kind of multidisciplinary or interdisciplinary education. I think one of the difficulties is that people believe simply by getting people in the same room as each other, then you can kind of miraculously change the way in which a social worker thinks about health, or a hospital doctor thinks about health. And of course, that's not the case, because as you suggested, we have these dramatic individual professional experiences, and to believe that we can kind of iron out the differences just by a couple of hours in the same lecture theatre at the same time is a bit of an error, I suppose, really.
Optimistic, too optimistic kind of view.
Optimistic, definitely. Yeah.
Okay. Practical resolutions. I mean, you've posed the problem after writing your book. Any thoughts on what we should do to resolve it?
Well, again, my argument in the book is that if health is a difficult and complicated concept, which it is, then what we need to do is to kind of work out academic strategies for dealing with it. Essentially what I'm saying is that health, arguments related to health, the study of health, can't be understood by rational means alone, as it were, by kind of, by reviewing the evidence and coming to the whatever conclusions we come to. And so what I'm proposing is a kind of sort of a whole person approach to the study of health that takes into account both the fact that there are some elements of that study that we can relate to objectivity, but there are others that we can't, that are much more kind of inspired by kind of ideologies, and that we meet through our own sort of set of professional and personal values and so forth. So my suggestion is that what we do is to engage both in the process of kind of sort of critical analysis, the actual kind of looking at the rational side of arguments about about health and the nature of health and what health studies ought to be, that we certainly have those kind of sort of, critically analytic arguments and develop our skills of critical analysis, but that what we also do is to engage in a process of critical reflection, which is really about taking a kind of a whole person approach to understanding what health is, that embraces both our kind of sort of feelings, our affectations, our experiences of health, synthesizing those with kind of sort of critical analysis and coming up with a view of health that is not just kind of cognitive and rational, but is also recognises and tries to explore through reflection kind of that the values that we hold in relation to health. And I think kind of one important practical outcome that it would be really nice to see emerging in professional education, I mean there are already starts to it, but kind of emerging much more strongly, is a focused attempt by educators to engage with these questions of what is health and what are the difficulties of studying health, and meet those questions, the problems that they raise through I suppose a kind of sort of a systematic course or program of education that is about values and the values that individuals and professional groups and so forth hold, and also about how those kind of sort of values play out into practice or potential practice. So that's I think where I'd like to see things going really.
Kind of a slightly provocative question.
Yeah.
Do you think that should also influence the way we pick or choose our health professionals? I mean, how we choose those who get into medical schools, into nursing schools. Yeah. Do you think that there's should be a shift in how we view what is required of our professionals?
Yes. Yes.
Because if you're thinking about, somebody who comes into the medical profession looking for that quantitative view, for a very, strict method-wise profession, and then you're giving him, values, value courses, and asking him to view people holistically, maybe it doesn't suit everybody. Maybe you need to think about, how to choose the people who get into medical school in order to fit them to this new, thinking about what health and disease are.
Yeah. I mean, traditionally, the way in which, for example, people have been chosen to be doctors to train for being medical practitioners is by virtue of them having kind of a strong rational mind, as you know, that kind of, in the UK, the kind of the classic medical trainee has been somebody with very strong science A levels.
Right.
Sort of, 2 A's and a B in chemistry and maths and physics or whatever it happens to be. And I suppose there's been kind of sort of a realisation over the last sort of 15 years in the UK, and maybe it's paralleled in Israel, I don't know, that what we need to be looking at is more flexible ways of encouraging entry into medical school, for example, that allow people who have the skills required to be a doctor in terms of things like sort of empathy and communication and so forth to be allowed the chance of entry. And so there have been kind of various projects that have been around looking at increasing the number of medical school entrants from minority and ethnic communities, where maybe people haven't been schooled to kind of get 3 straight A's at A level or whatever. There has been an increasing emphasis on encouraging people into medicine who are not necessarily 18 years old, as it were, who kind of sort of in mid-late 20s or perhaps even older than that, but who have kind of the life experience that provides them with kind of the empathy, the communication skills that are necessary for being a good practitioner, and all of those projects seem to me to be really, really sensible. I mean, what I'm not suggesting is that we need to kind of do away with people who are, you know, spot on scientifically. What I am suggesting is that we need to try and mellow or continue the process of mellowing our entry requirements, not just for medicine but for other kind of professions related to medicine, so that we look at the whole people who are coming in and not just at kind of, you know, whether they're good at science and good at writing exam questions about science. So, yeah.
Okay, brilliant. So again, Critical Perspectives on Health, your new book.
Great.
Thank you very much for coming here, and good luck with the book.
Great.
Thank you.
Thanks very much. Thank you. Thank you.